So the first thing you want to do is you want to look at your orders. You want to make sure that you have the right patient, and you are also going to be looking for what type of solution you are going to irrigate your wound with. With the solution, it's important that you do your 3 med checks because saline solution and sterile water are considered medications. So you need to do 3 med checks and check your expiration date. You would also, at this time, gather all your supplies that you're going to need, and you would go to your patient's room. You would introduce yourself to the patient. You would ask the patient to identify themselves with 2 identifiers. So you would ask the patient for a name and a date of birth. You would also ask the patient if they have any allergies. And at this time, you would also do a pain assessment prior to doing your wound irrigation and your dressing change. So you want to ask your patient if they're having any pain. You want to ask them to rate that pain on a scale of 1 to 10. Depending on their answer, you will then administer pain meds to the patient, and you would come back 30 to 40 minutes later after giving them medication and perform another assessment and make sure that their pain is under control prior to doing your procedure. Next thing we are going to do is perform hand hygiene. Going to put on our gloves. Make sure you have a garbage receptacle with you. And we are also going to make sure that we provide privacy for our patient and make sure that we are exposing as little as possible when it comes to doing a dressing change and irrigation. So the first thing we're going to do is remove the current dressing that is on the wound. So what you want to do is you're going to remove layer by layer. You want to make sure that you do this out of the view of the patient so that they're not seeing what's on the dressing. I'm going to go layer by layer until we get to our wound. When removing the dressing, you want to be looking at color, odor, consistency, and amount of any drainage that may be present. After we remove our dressing, we are also going to look at our wound. We are going to look at the peri-wound area, and for this patient we would say that there is some erythema going on here. We would also look at the bed of the wound, and we would, note that that is beefy red, and we see some granulation tissue going on, which is a good sign of healing. So now that we have done that, we are going to measure our wound. You want to make sure that you are measuring your wound in centimeters. You also want to make sure that you are not touching your measuring device to the wound. So first we are going to measure length. So I would say that this wound is 7.5 centimeters. We are also going to measure the width, which is about 3 centimeters. After we've measured the length and the width of your wound, you are going to grab your sterile swab, and you are going to take your swab into the deepest point of the wound. Line your fingers up with where the wound stops. You're going to take it out, and you are going to measure the length of your swab, and that is about 2 centimeters. Next, we are going to remove our gloves, perform hand hygiene again, and we are going to start opening our things so that we can irrigate our wound. So when opening things, you want to make sure that you open them away from you. We are able to touch this because the outside of this is not sterile. We are going to pour in our solution. Again, make sure that it's the right solution. Make sure that it's not expired. When taking the syringe out, you want to be careful not to touch the part that goes into the bottle, but only touching these outer parts here. So we're going to open our solution, pour it in, making you palm the label like always. We are going to put our syringe back in. At this point, you are going to put gloves back on. We are going to reposition our patient so that when we're irrigating the wound that the solution is flowing with gravity. We are going to use our container as a receptacle to catch the excess solution, and we are also going to put a chucks under our patient so that we don't get their bed all dirty. So now that that's done, we're going to hold our syringe, making sure we don't touch the inner part that goes into the bottle. We're going to pull back, get our solution, and we're going to irrigate the wound top to bottom. And we are going to do this, if our order says until clear, we're going to make sure that we do it until your solution runs clear. Now that irrigation is done, we are going to move our gloves. Again, perform hand hygiene. We are going to get our package of Curlex. We are going to open it away from us. We are going to palm our solution, going to pour it on our Curlex. Next, we are going to open our kit for the dressing change. Again, we're going to open this away from us. Where is a drape? Drape was on the floor, excuse me. So now that our kit is open, we are going to lay out our sterile drape. I'm going to carefully remove it, being mindful of our 1-inch border. We're going to lay that down. Next thing we are going to do is we are going to put on our sterile gloves. Making sure that we do not contaminate them. Want to make sure that you keep your hands above your waist. Make sure you don't touch your face like I was just about to do, or touch the tabletop or touch anything that is not sterile, because now your hands are sterile. You want to make sure that, again, your hands stay above your waist, and you want to make sure that your workspace is above your waist as well. Now that we have our sterile drape, we are going to put our supplies onto the drape. So I'm going to grab my tweezers, my tape, my 4x4s, and my ABD pad. Next thing we are going to be doing is we are going to pack our wound. So you want to grab your Curlex out of the solution and packaging. You want to squeeze it out so it's not soaking wet. You just want to rearrange this. Rearrange your Curlex so that it will be easy to pack. There we go. And you're going to kind of snake it in your hand. You can use either hand for this. And again, don't touch your face because I almost just did just now. You're going to grab your tweezers and you are going to feed this Curlex into your wound. Starting from top to bottom. You want to make sure that you are not touching the outside of the wound, because then if you do, you're gonna have to start over. And your packing should look like this. Now that we have packed the wound, we are going to grab a 4x4, place it on our wound, and we are going to grab our ABD pad and place that on the wound with the blue line facing up. I don't know if you can see that. Yep. Now that that is done, the sterile part of the procedure is done, so you can toss everything out. And the next thing we are going to do is make sure that we secure our ABD pad and our dressing with some tape. And after that, you are going to get a piece of tape. You're going to put your initials on it, the date, and the time that the dressing change was done. Stick that on your dressing, and that is it. Like always, before you leave the patient's room, you want to make sure that they're comfortable, that they have everything that they need, that they have their call light, and you are going to perform hand hygiene again, and you are going to document your dressing change. Also, while doing this procedure, you want to make sure that you maintain your sterile field, keeping your hands above the sterile field, never turning your back to the sterile field, and avoid crossing over your sterile field. Just wanted to add that in there.